Are you interested in getting into nursing school or learning what it takes to be competitive for your dream nursing program? Stay tuned. I made this video just for you. I graduated as a registered nurse, RN, and let me tell you, it kicked my butt. However, now I'm ready to share with you all of the tips and tricks needed to get into the nursing program, and in another video, what it takes to be super successful, how to study, how to take notes, and so on. Share this video with friends, family, or anyone you know that is interested in getting into nursing school and being successful through the program. If you're interested in seeing more health, fitness, exercise challenges, yoga videos, superfood recipes, and nursing tips, go ahead and subscribe so you don't miss out. Without further ado, let's get into it. Getting into nursing school can be very challenging. However, with careful planning, hard work, and preparation, you can increase your chances greatly of being accepted into your dream program. There are about 5 basic steps that I'm going to go over to help you get prepared. The first one is to research the nursing schools near you or the ones that you are interested in applying to. Understand how you can prepare for that specific program. So I'm just going to read off some notes that I took here so that I don't miss anything and so that I don't waste your time or my time. So let's see. The first thing is that you must be very competitive to get selected into the program, especially the registered nurse program. So before you get your ass kicked in the nursing program, you have to get your ass first kicked in the prerequisite classes. So each nursing school is different, and they do require similar type of prerequisite classes. So I'll tell you the ones that I was required to take to be able to apply to nursing school. Some of the required prerequisite classes were math. I went ahead and took finite mathematics, which is required for the bachelor's degree in nursing, so that was already out of the way when I went to get my bachelor's later. You also have to take English composition, which is just like your basic in English class, public speaking or something of equivalence, chemistry and sociology, psychology, and a few electives. You also have to take the weed out classes, which are anatomy and physiology. I took anatomy and physiology 1, 2, and advanced physiology, which was required for my nursing program. And after you take the prerequisite classes, then there are only a few of those prerequisite classes that are calculated in the scoring towards your competitive score to get into the nursing program. So the ones that they looked at at my school was English, anatomy and physiology, and psychology. But they also look at your GPA, so those that have straight A's or a 4.0 and above were more likely to be selected first and not put on a wait list. So basically, you want to maintain straight A's in all of your prerequisite classes. The TEAS exam, which means the Test of Essential Academic Skills, this is the required entrance exam, and along with your good grades, your 4.0, they also look at your TEAS score. The TEAS covers mathematics, science, reading, English, and English grammar. So as a nurse, you'll have to be a skillful communicator because you'll be talking to patients from all types of populations, their family, physicians, pharmacists, other nurses, physical therapists, social workers, case managers, and so on. So you have to be a skillful communicator and show empathy and compassion at the same time. When it comes to mathematics, you'll have to demonstrate that you are able to do basic conversion mathematics in the nursing program regularly. Once you get into the nursing program, you will have to do basic conversion math problems on just about every test or every quiz, every exam, every final. So be prepared to get really good at conversion math. If you're interested in learning more about how to prepare for the TEAS exam and which books are best to study for the TEAS exam, and how to successfully pass the TEAS exam, check out my video about that. After you've taken the TEAS exam, you will then have to apply to the nursing program. So you will submit an application, and they will be able to see your grades in their required prerequisite courses, your GPA, and your TEAS exam score. They will also pull your transcripts to see what type of student you are overall, if you've made the honors list, and so on. So make sure that you're a hard worker, you study super hard, do whatever it takes to help you stand out. Once you're in the nursing program, be prepared to purchase a lot of supplies. Now, the nursing school will give you a list of things to buy, such as a stethoscope, a pen light. I have a list here: binders, notebooks, clipboard for clinicals, pens, highlighters, the required scrubs for the program, the required lab bag. You'll have to have a nursing badge and your picture, and that's part of your uniform. You cannot forget to wear your badge any day. The proper shoes, a secondhand watch, a manual blood pressure cuff, compression stockings if you have trouble standing and you have legs that swell from too much walking, and hand cream. You'll be washing your hands a lot. So nursing and medical school is run like the military. We also use military time. So for example, 1 p.m. would be 1300, 5 p.m. would be 1700, and so on. You'll learn that throughout the nursing program. This is how we document in our charting system once you are a nurse. Also, before I forget to mention, many nursing programs do not like it if you have brightly colored hair like green, pink, purple. Same for nails. Nails must be cut short and not have brightly colored nail polish, because long nails carry bacteria underneath them and it's harder to clean them. And we have to maintain proper sanitation when you work in the hospital or in any clinical setting. I have seen students be sent home before because their scrubs were not ironed, or their hair looked messy, or they were wearing yellow or purple nail polish or something like that. They've definitely lost points if not sent home from clinical. Additionally, I've seen students called out or sent home for forgetting their supplies or their lab bag on the day of lab or clinicals. So make sure that you set alarms and that you are prepared. Other supplies include surgical tape or some kind of medical clear tape, and scissors, emergency scissors. Other things that are not required, but I swear by, is a digital voice recorder. When you go to school and you have in-person lectures that you cannot hear again once you get home, it would be nice to be able to replay a lot of what the professor was talking about, especially when it's really difficult medical lectures. So I asked my professors for permission to record them, and they were totally fine with that. So a digital recorder comes in handy. If you're interested in learning more about how I studied in nursing school and seeing how I took notes, because I did save them and I can show how I wrote everything down and fit a lot of information onto one paper. If you're interested in understanding what to focus on when it comes to study material in nursing school, check that video out. I will leave a link in the description box below. If you found this video helpful, please hit that like button, subscribe, and share with your friends, family, or anyone else that will be interested in videos like this. I have more coming for you regarding health, fitness, yoga videos, exercise challenges, nursing tips, and more. So thank you so much for watching, and stay tuned until next time. Bye for now.